If you need to relieve pain from arthritis of the hip before having to have surgery, there are several things you can do. The first and very common way of treating it is with an anti-inflammatory like Advil or Aleve. And people ask me which one is better. And it's different in different people, though Advil or ibuprofen tends to work better, I think, in most. Activity modification is another way of dealing with it, where you ask people not to jog because that kind of pounds on it, makes the pain worse, can make the arthritis progress a bit worse. Other things include injections. Steroid shots in the hip typically don't work an extended period of time, but they are an option and they are covered by insurance. Other injections like platelet-rich plasma are not covered by insurance, but can be helpful and potentially be helpful for a more extended period of time. The more expensive injections that aren't covered include amniotic fluid or stem cells. Both of those have very strong anti-inflammatory factors in them and can make the pain better. Stem cells can potentially help protect the remaining cartilage. They're not going to regrow any cartilage. They're very expensive, and I think the indications for those are very narrow, but they are in the what we call armamentarium of methods to treat the pain without having surgery. Elderly people sometimes use a cane in the opposite hand, because if you have the arthritis in your right hip, it's not your right hand that goes forward, it's your left hand that goes forward when you walk. So you can use a cane in the opposite hand. Most younger people don't want to use a cane and typically stay away from that, but those are things that you can try before having to have the surgery.